how much salary package you can expect after passing out of MD Paediatrics without any fellowship or super specialization in Tier 1, Tier 2 and Tier 3 cities.
Initial salary will be like 90,000 to 1 lakh. Corporates pay around 1 lakh and medical colleges around 80,000-90,000 in private.
How are the vacancies in medical colleges for assistant professor in pediatrics?
Nowadays, new medical colleges are coming up. I think it is easy to get assistant professor in new medical colleges.
So what do you have to say about the saturation in pediatrics?
Due to increase in seats, eventually I think pediatric branch is going to get saturated.
What are the cons of taking pediatrics? What points every NEET PG aspirant must know in mind before choosing pediatrics?
Cons of taking pediatrics is that it is highly demanding branch. That means you have to give your 100% to work in that branch.
Hello everyone, Dr. Rahul Chawla this side. Welcome to episode 15 of NEET PG Mentoring Sessions. And today we are going to discuss about the future scope of pediatrics. And to have this conversation, I have with me Dr. Nirmala B S. She did her MD Pediatrics from Bangalore and right now she is practicing in a corporate hospital in Andhra Pradesh. She's also associated with healthbill.com as health educator. Welcome, Dr. Nirmala.
Thank you, sir.
Dr. Nirmala, as you know that in this particular podcast, we discuss about a particular branch and its future scope, how the residency is like, what are the pros and cons of taking that branch, what is the earning potential, the super specialization, fellowship options, and various other facets of the career in that particular branch. So, Dr. Nirmala, starting with our usual line of conversation, why did you decide to take pediatrics? Was it a conscious decision? Did you always wanted to be pediatrician? Or is it like you are not getting your dream branch and then you decided to take pediatrics?
I was interested in pediatric branch as such in my UG days. And I was liking to be around kids. So that is the reason I actually took pediatrics.
And how much was your rank in NEET PG?
It was 6,000.
What were the other options that you were getting?
I was getting optal, ENT, anesthesia, psychiatry, those branches. And OBG, surgery as well, and orthopedics, all those branches. But I preferred pediatrics over all those branches.
And did you do any research before taking the branch?
Not much.
So basically you wanted to be pediatrician and this is what you got and ultimately you took that branch. Okay.
Yes, yes.
And how was your residency in pediatrics like? We all know that pediatrics is a tough branch like medicine and surgery. The workload is immense. There are 36 to 48-hour shifts and there is no such work-life balance, at least in residency. So was it the same or something different?
In ESI, we used to have a lot of patient load. So our PG was very hectic. We were having duties like 36 hours, 48 hours. So COVID was stuck when we started our residency. So initially it was all about COVID duties and a few of my batchmates falling sick due to COVID, all those things, shortage of PGs. So it all affected us. So it was very hectic and we hardly got to sleep. And it took us time to get adjusted to the department as well. Overall, I must say that there was no free time for us, especially in first year.
How was the exposure to pediatric subspecialties in your hospital, be it pediatric neurology, pediatric nephrology, hemato-oncology? And which is the better option? To work in a hospital which doesn't have any subspecialties or to work in a hospital which has all the major subspecialties in pediatrics?
In our hospital, there were not much subspecialty branches. It was more of general pediatrics and emergency management like PACU and NICU management. So I feel that when there are subspecialty branches, we get to learn more, like what exactly happens to the child. We will know better. That is what I feel. So we have had more exposure in NICU, PACU, and emergency cases and general pediatrics. In that, we were thorough. But when it comes to pediatric endocrinology or pediatric nephrology, we were actually referring cases to corporate hospitals because ESIs have tie up with corporate as well. So further management used to happen in corporate. So that way, I felt that whenever some institute has subspecialty, they will actually get in-depth knowledge about particular diseases.
So indeed, it's good if you have multiple subspecialties in your department, then you can know how to diagnose, approach those particular cases and how to treat them. So what are the different procedures that you used to do routinely in your residency, like exchange transfusion or biopsy or bone marrow aspiration?
Yeah, we routinely used to do procedures like lumbar puncture, central line access, PICC line access, and yeah, occasionally bone marrow aspirations, and yeah, ICD insertions, and yeah, obviously intubations and yeah, managing kids on mechanical ventilators. All those procedures routinely done.
So did you had any exposure to dialysis or exposure to hemato-oncology?
Yeah, hemato-oncology, yes. We were posted in Kidwai Hospital, Bangalore. So we had seen variety of cases and we were taught about the same in that institute. And even bone marrow aspiration, etc. Procedures were also given to us for performing.
What are the different options for fellowships and super specialization after MD Pediatrics? And is doing DM really essential?
After MD Pediatrics, various fellowships available are neonatology and PSU, critical care, and others include neurology, endocrinology, and recently even developmental pediatrics are given utmost importance. And post MD DM include neonatology and PHCU and critical care and even hemato-oncology and endocrinology. I think it is available only in PGI Chandigarh as of now. So the trend is changing. Nowadays, almost all corporates are asking for fellowships and DM, even in Tier 2 and Tier 3 cities. So pediatrics is no longer an end branch comparatively. So I think over 3 to 5 years, it may become like MD General Medicine, where almost everybody are into super specialty. Even pediatrics, like post MD, they will have to think of doing fellowships and DM. So even in corporate, they differentiate actually like D post DM, they are paid well compared to fellowships, and post MD, most of them work as registrars, and even after that, promotion is becoming little tougher. But when it comes to joining medical college, I think MD is good enough or DNB is good enough. As after SR, you can become assistant professor. So that is okay. But if you have to work outside in private or like fellowships and DM are mandates.
Does it make any difference whether you do MD Pediatrics or DNB?
No, as such, no, because actually skill is more important than the degree. And nowadays, nobody is differentiating between MD and DNB. Everybody says that DNB from better institute is better than MD from worst institute. So it doesn't make a difference. Maybe in medical colleges, MDs are given preference over DNBs. And now also trend is changing actually. Even DNBs are also considered, but still somewhere MDs are given little preference in medical colleges. But in corporate setup or anywhere private, they will consider your skill more than your degree. That is what everybody says, and that is what even I have observed.
The problem with DNB is that the pass rate is quite low, and there are many private hospitals which do not have enough patient volumes in OPD, in the emergency, and in the wards. So I believe that learning is definitely hampered if you join some institutions. So it's good to at least do a background check before joining a DNB institution.
Yeah, definitely. We have to do a background check before joining DNB Institute. but reputed institutes always have an edge over medical colleges that are far below the expected standards. So, actually, yeah, correct, sir. We have to definitely check whether the institute is good before joining. Pass percentage in DNB is quite low, but in recent years it has improved actually. It is comparatively better.
How easy or difficult is it to get SRship in good institution after MD Pediatrics?
I think it is quite difficult to get SRship in good institutes. But once if you do some fellowships, some good institutes consider you because you have better skill. Overall, it is tough to get in a good institute, but somewhat like if even if you work in a government institute, I think your knowledge will eventually improve comparatively.
So it's a better idea to do SRship after MD if you are not planning to do fellowship or a super specialization degree. But in case you have already planned to do super specialization or fellowship, then definitely do not get stuck into that race of getting into SRship. Straight away plan your journey for fellowship or super specialization just after your MD. That would just save your time.
Yes, that will save your time. And I feel like joining SRship is mandatory if you are planning to continue in a medical college. Otherwise, it is not necessary. You can work as registrar in a corporate hospital. I mean, very good corporate hospital. There you will get variety of cases. You will learn high-end case management. So it is not mandatory. It depends on how you want to settle.
And how are the vacancies in medical colleges for assistant professor in pediatrics?
As nowadays new medical colleges are coming up, I think it is easy to get assistant professor in new medical colleges, but top medical colleges or even in central institutes, they are preferring DM over just MD. That is the trend happening in recent years. So if you have to get in a top institute, I think you will have to have additional qualifications. But in normal medical colleges, newer medical colleges, still job vacancies are there. But after 3 or 5 years, it may get saturated. And sometimes, yeah, very well-known medical colleges, it is tough to get.
A new trend that is emerging in the recruitment of assistant professors in pediatrics, specifically in central institutions, is that in the hospitals which already have different subdivisions like pediatric neurology or pediatric nephrology or hemato-oncology. So obviously, if they have to hire assistant professor in pediatric neurology, they would be hiring somebody who is DM pediatric nephrology, who is DM pediatric neurology. But even in the recruitment of assistant professor in general pediatrics, they are hiring a DM candidate. So where would those candidates go who have just MD medicine or maybe a fellowship? So that is a huge problem that is coming up. And that also, I think, points towards the saturation that is happening in pediatrics. So what do you have to say about the saturation in pediatrics?
Yeah, due to increase in seats, eventually I think pediatric branch is going to get saturated. As of now, vacancies are available in new medical colleges or in private hospitals and to some extent in corporate hospitals. But because of vast number of seats, MD Paediatrics is getting saturated. So it is better to settle early. Whatever it is, decide early how you have to settle whether you have to do DM or fellowship or start your own practice, whatever it is. We have to plan our settlement as early as possible. Otherwise, it is going to be very tough due to increase in competition.
And how is the earning potential after MD Pediatrics? How much salary package you can expect after passing out of MD Pediatrics without any fellowship or super specialization in Tier 1, Tier 2, and Tier 3 cities?
Tier 1 cities, initial salary will be like 90,000 to 1 lakh. Corporates pay around 1 lakh and medical colleges around 80,000-90,000 in private, and government colleges in the south are paying around 60 to 70,000. That is the situation post MD. And in tier 2 cities around 1.2 to 1.3 lakhs. and tier 3 around 1.3 to 1.5. And in private hospitals where there are lots of patient load, it may go up to 1.8 lakhs as 8 lakhs for a fresher. But it depends on the patient load and many other things, and number of duty hours as well.
I think the salaries are quite low in South India. In North India, it's going to be like 1.5 to 2 lakhs in tier 1 city, 2 to 2.5 or even 3 lakhs in tier 2 city, 3 to 4.5 lakhs in tier 3 city, depending on the demand. That is without any fellowship or super specialization. However, getting a job is really difficult in tier 1 city. And even if you get the job, you will get a job as an attending or an associate consultant, and then they would not promote you as a consultant for at least 4 to 5 years. So the growth is not happening, and many a times you will have to leave that place or join some other corporate hospital, and somehow you would be restricted to that tag of assistant or an attending consultant. Or even if you are made consultant, you are not given independent admissions, and obviously that would restrict your earnings also.
Yes, I think North India has better opportunity due to less number of doctors, but in South India, number of doctors are too many, so there is quite saturation.
How much can you earn post MD Pediatrics if you also do a DM or a fellowship?
Post MD fellowship in tier 1, salary will be some 20 to 30,000 extra compared to just MD, and DM salary will be around 2 lakhs. And in tier 2 cities, post fellowship salary will be around 2 lakhs and DM around 3 lakhs. Tier 3 post fellowship will be around 2.5 lakhs and DM 3 to 4 lakhs starting salaries.
So post DM also the salary is lesser in South India compared to North India. But there is a difference in MD Pediatrics and MD Medicine is that after MD Medicine, you may not get anything more than 1.5 to 2 lakhs in tier 1 city to begin with. However, if you do DM, then you may easily earn up to 2.5 to 3.5 lakh rupees. So the earning really enhances after you do DM post MD Medicine. But if you do DM post MD Pediatrics, it doesn't make that much of a difference.
Yes, actually, in medical colleges, salary for MD Pediatrics Assistant Professor and DM Pediatrics Assistant Professor is same. That is also a catch. And yeah, compared to North India, South Indian DM post MD Pediatrics are paid less. And yeah, post MD General Medicine, whoever does DM are paid better than DM post MD Pediatrics. That is a trend.
I think it's very important to have your own clinic while you are working in private hospitals, especially if you are a physician or you are a pediatrician, because opening a clinic for a physician or a pediatrician is not much of an hassle. Theoretically, you just need a stethoscope, a table, chair, and a small setup, and you can easily start your own practice. So I believe you also have your own clinic. And how do you manage your own clinic? How is the initial investment like, and how do you go about marketing of your own clinic?
Yeah, it is better to have our own clinic because, yeah, as you said, it gives us financial independence. So we tend to start it like a smaller setup, and eventually, if patients are coming, we can develop it well. So yeah, we can just start with just a table and stethoscope. And once patients come, like pediatrics, there will be vaccinations and so many daycare cases. So we can treat all those in our clinic. So setup cost is also very less initially, can be somewhere from 5 to 6 lakhs, and very sophisticated clinics can be built in around 10 to 15 lakhs. So that way, even in tier 1 cities, I know so many of my friends who are doing well just by opening clinic. They are earning around 2 lakhs just with MD Pediatrics, and they have a sophisticated clinic and they are doing that good. So clinic is also a good idea. And in tier 3 cities and in towns, opening clinics, you can see as much as patients, like hundreds of patients in one day, because so many connecting villages will come to that town or a city. So that way pediatricians earn well in towns and in tier 3 cities.
And how do you go about the marketing of your clinic?
Marketing usually nowadays, because of social media influence, many pediatricians are very active on Instagram. They will be giving advices regarding child nutrition, growth, development, etc. That way, patients also will see that and they will actually go to the doctor. Other ways of marketing is that in autos or bikes, will give announcement, and digital marketing as well, like in local TVs it will be shown, the clinic will be shown, and all those information will be spread.
What are the cons of taking pediatrics? What points every NEET PG aspirant must know in mind before choosing pediatrics?
Cons of taking pediatrics is that it is highly demanding branch. That means you have to give your 100% to be to work in that branch. The thing is, like, when a child gets sick, you have to be there monitoring the child every hour or sometimes every 30 minutes. You will never know what will happen to the child because the child doesn't tell you. You have to watch for signs and symptoms in the child. So that can be very, very demanding from your side. So it can be sometimes very stressful with the parents being very apprehensive. So pediatrics is a branch where you need empathy, and you have to try to understand their parents, like what they are thinking about the child, because you have to counsel them so that they will cooperate well with you for the treatment. That is very important. So pediatrics is not as fancy as it sounds, because when one child gets sick, the amount of stress you undergo until it comes out of that critical phase, that is too overwhelming. So you have to be very careful about that. So, and it takes little time for us to adjust when we do a PG. First 6 months, we may not be able to catch up with the flow, like in identifying which is sick child, which is okay. We will not know that easily because we don't have that much exposure in our UG time, because pediatrics is a minor branch in our UG time. So that is one thing, and because of increasing seats, too much competition in the branch, so need for fellowships or DMs is one thing. And one more thing is the way you counsel, even after you pass out, you have to convince the parents to cooperate with the treatment of the child. So that is too tough. So good pediatricians, or those who counsel the parents well, those who advise them to continue the treatment, and those who believe in holistic approach towards child's health. It's about nutrition, growth, immunization. Nowadays, even about vaccination, parents are confused whether to take it or not. All those things should be considered. So it is getting tougher because of this internet era. So much misinformation is happening. So parents are actually confused. So it is your duty to convince the parents. So that is very, very difficult nowadays. And one more thing is, a patient's mentality is that they will go to senior pediatricians. So when you start your own setup, or when you work in a private hospital as a junior doctor, nobody will come to you. They will go to senior pediatricians. So it may take time for you to establish in private practice as well.
Yeah.
And during peak time, long working hours also may overwhelm you sometimes, but you have to be tougher. That pace will go on like that, and that it is like in PG time you learn the maximum. Any procedure or seeing any cases, PG is the time when you learn the maximum. So you have to give your 100% during your PG time.
That was a very elaborate answer, Dr. Nirmala, and I hope it's going to clear confusion of our listeners. Thank you so much for your time. It was great to have you here.
Thank you, sir.